Let's talk about jaw clenching and facial slimming. The main muscle involved with this treatment is going to be the masseter muscle. It's a very thick, broad muscle that extends from your cheekbones to your mandible. Its primary action is to help us with biting and chewing. It has two layers, a superficial layer, which is actually the thicker of the two, and a deep layer. The superficial layer has most of the action when we're biting and chewing. The deeper layer is for more subtle movements of the mandible, like when we're speaking. To examine this area, have the patient bite down as hard as they can, like they're chewing on a piece of steak. What you'll be able to see is that the masseter will actually flare out if it's big enough. On top of this, include in your physical examination actually placing both hands on either side of the masseter and feel it move underneath your hands as the patient clenches and relaxes. This will give you a good idea for the actual strength of the muscle. Sometimes you'll find that there is not much movement or that the muscle doesn't bulge out a lot, but the patient still has significant symptoms of teeth grinding or jaw pain. If this is the case, you can still treat based on the symptoms, not just based on the physical examination. My technique for treating this area is to firstly mark out the borders. The first border is to identify the risorius muscle. This is the muscle we don't want to inject during this treatment. Draw a line from the corner of the mouth to the base of the ear. This will identify the general path of that risorius muscle. We don't want to be injecting on that line or above it. Injecting above that line, we may hit some other muscles involved with smiling. Once we've marked out that line, the second is whilst the patient is clenching and biting down, you'll be able to feel under your fingers the masseter roll away. Draw a line where you feel the edge of the masseter, straight down to the jaw. Thirdly, from the base of the ear, draw a line down to the very corner, the angle of the mandible. This will help identify where the parotid gland lies. There's two ways to inject this area. Firstly, you can use a dice pattern. One injection right in the middle and then 4 surrounding, similar to the 5-side of a dice. This will affect the entire muscle and hopefully blanket it in neurotoxin to relax it. Alternatively, you can find the bulk of the muscle and inject directly into it and just lateral on either side. It's very important that when you're injecting to inject deep. If you inject too superficial, you will not get the full effect and give the patient the relief they need. The primary complication that I worry about in this area is affecting the smile. But if you stay within that bordered zone, there shouldn't be any reason to hit the risorius muscle or any of the zygomatic complex muscles that are involved in smiling. Hitting this muscle can cause an asymmetric smile, which can be quite devastating for the patient. Due to the high dose that we're injecting, it might take quite a long time for it to wear off. So take extra care when injecting this area. So we're going to move on to the jaw treatment now for masseters. Now, first things first is get the patient to clench down, bite down like they're chewing on a piece of steak. Try to observe and relax for us if there's any change in these two regions of the face near the jawline. Biting down again for me whilst I have my hands on the patient's face and I can feel the masseter popping out and touching my hands and relaxing. Bite again. You can see as my hands go out and relax, there's definitely some movement in there. I'm going to demonstrate on this side. So I'm going to clean the area. We're going to draw and mark out all our landmarks. I'm going to get you just to look over to the right for me. Okay. So the first landmark that we're going to draw is the risorius muscle. The risorius muscle is going to start at the corner of the mouth and extend up towards the ear. If I get Emmy to give me a big smile, you can see exactly how that muscle is working to pull the corners of her mouth upwards and relaxing. So I'm going to mark out that corner and the base of the ear. And I'm just going to connect the two. Perfect. Next, I get the patient to clench for me, so biting down. I can feel the bulk of the muscle here, and you can see my finger can roll down right here. That's the end of the masseter muscle here. and relaxing. So that area, we're going to mark with a straight line right down to the jaw. There's the angle of the jaw, angle of the mandible. I'm just going to draw out this region. The parotid gland sits in this area. We don't want to inject too much into this zone. The two patterns we can do include the dice pattern, so one in the middle, and then 4 around. That gives us a nice blanket approach to the masseter, which is going to target the muscle in its entirety. Alternatively, if a patient had a very bulky masseter muscle just in one area, for example, in this area here, we could do the majority of our injections in the center and then place one laterally on each side, or wherever the muscle is still strongest at. It might be a little bit higher, it might be a little bit lower. Regardless of which pattern you choose, the injection technique is going to be the same. It's going to be a deep injection. For this example, we're just going to do one in the center. Once you've identified the place you're going to inject, using your non-dominant hand, place your fingers around the injection site. With the injecting hand, you're going to rest on the non-dominant hand. Get the patient to clench. You can see that the muscle bulges up. Could you keep clenching for me, Amy? Get the patient to continue clenching. 1, 2, 3. All the way down to the hilt of the needle. Push, and then start injecting, and stop, withdraw, and relax. And you can relax too, Amy. Mandible. The parotid gland is sitting in this region here. And then we complete our treatment zone with our dice pattern, where we will inject deeply in all 5 areas. Or in the case where we have a very large masseter, perhaps located with most of its muscle bulk in this area, we're going to inject directly into that zone and 1 or 2 around.